Can you be too old to get bipolar disorder? Actually, no, and that's what I'm talking about today. I'm Dr. Tracey Marks, a psychiatrist, and I make mental health education videos. The typical age range that people develop bipolar disorder is between 20 and 40 years of age. In a video where I talk about how to tell the difference between major depression and bipolar disorder, I say that oftentimes the symptoms of anxiety or depression will start in the teenage years and then later become bipolar disorder in the early to late 20s. And this is still true. That's the usual. But there is a minority of people who develop bipolar disorder later in life, and it tends to look and act a little differently. The International Society for Bipolar Disorder Task Force classified the illness into 3 categories, and for the purpose of this video, I'm going to use the term manic and hypomanic interchangeably. You can watch this video for details on how we define mania and hypomania. Early onset bipolar disorder is where the first manic episode occurs before age 40. Late onset bipolar disorder is where the first manic episode occurs after age 50, and older age bipolar disorder is where the first manic episode occurs after age 60. Notice this criteria is based on when you have your first manic episode. This is because mania is what defines bipolar disorder. Both major depression and bipolar disorder have depressive episodes, and it's very common for people to start out with their depression as their first mood episode. Then they carry the diagnosis of depression until they have a manic episode. Then the diagnosis changes to bipolar disorder. It turns out about 25% of people with bipolar disorder have an older age onset. So I know what you're thinking. I've had 3 episodes of depression in the past 15 years. How do I know if I'm really going to end up with bipolar disorder? Should my doctor put me on a mood stabilizer now? The first answer to that is we don't have a way to reliably predict whether someone is going to develop mania at a later point. The second answer is no, your doctor shouldn't add a mood stabilizer to prevent you from having a manic episode if you're currently doing well on your antidepressant. A soft sign that maybe what you have or that your depression could later turn out to be bipolar disorder is having an anxious, agitated depression that does not respond well to an antidepressant. I talk about depression with anxious distress in this video. There are still some experts who believe that depression with anxious distress is really a part of bipolar spectrum illness, but we still haven't officially adopted that terminology. I mentioned in my discussion of depression with anxious distress that one of the ways we treat it is by adding an antipsychotic or a mood stabilizer like lamotrigine. That's not much different from the way we treat bipolar disorder, except with bipolar disorder, we try and eliminate the antidepressant so that all you would be on are mood stabilizers. Oddly enough, I've had some patients who took antidepressant after antidepressant and would have horrible side effects or just couldn't seem to do well on the antidepressant. I added an antipsychotic like brexpiprazole, which is FDA approved for treatment-resistant depression. Then I slid off the antidepressant that was giving them all those side effects. Then the world just opened up and they did great only on the brexpiprazole. If I had a crystal ball that would let me look into the future, I may see that adding brexpiprazole treated what was really bipolar disorder, even though the drug isn't FDA approved for bipolar disorder, and that adding the antipsychotic kept them from having the manic episode that would have established a late onset or older onset bipolar disorder. But I don't have a crystal ball and I can't predict what will happen in the future. The takeaway is that if you're doing well on an antidepressant alone, then good for you and stay the course until something changes that suggests that your symptoms are looking more like manic symptoms, or if you stop responding to the antidepressant. What if you start to get anxious? Sometimes it's hard to tell the difference between anxiety and mania. I have a video comparing anxiety to mania and how to tell the difference between those two. It's good to look at that video if you've had a depressive episode and then start to have some anxiety and wonder, uh-oh, is this a manic episode coming? Is this the doomsday that Dr. Marks spoke about in that late onset bipolar disorder video? Having depression become bipolar disorder doesn't have to be a doomsday. On a positive note, psychotic symptoms are less common or less severe with older onset bipolar disorder than it is with early onset. The psychosis, in combination with impulsivity and poor judgment, is what can really cause a lot of the destructive behavior during the episodes. Because of being older and possibly having more medical issues, your doctor will have to pay close attention to how your medical conditions may affect you mentally. Also, with older onset, there tends to be more cognitive issues like memory, focus problems, and impaired problem solving. So the takeaway here is to be aware that if you have depression or have ever had recurring depressive episodes, there's a possibility of having a late onset episode of mania or hypomania. That doesn't mean you need to change anything now. It just means be aware that your doctor may need to treat you with different kinds of medications at a later point. Also, since we know bipolar disorder responds well to having a structured schedule, as a preventative measure, you could work to maintain a regular schedule of eating and sleeping around the same times. Now is the time to clean up your diet and reduce inflammation, as inflammatory markers are higher in people with depression and bipolar disorder. I did a video talking about how the Mediterranean diet was used to treat depression. I plan to do some more specific lifestyle videos to help you modify your lifestyle to prevent illness. No one can predict the future, but you can certainly do things that work in your favor to prevent episodes or lessen the intensity of them. So instead of seeing this as a doomsday prediction, let's see it as a warning of what can happen and use knowledge and action to improve your outcome. Thanks for watching. See you next time.